If you are HIV positive, you walk in through our doors, you will be seen.
I have several other members who are striving for the same goal as me, which is having this patient reach their highest level of health.
I wouldn't be where I'm at now if it wasn't for the staff and the facility.
HIV prevention is something that we have focused on.
No one's going to turn you away.
The Ryan White program has really saved my life.
Ryan White provides us funding for primary medical care, but it also provides for those wraparound services that are critical for patients being successful.
Taking care of any chronic disease, whether it's HIV or diabetes or depression, you have to make sure that the social issues are controlled for someone's life. If they don't have a place to live, they're probably not going to be very good at taking their medications. If they don't have a transportation, they're not going to make it to their appointments.
We've learned for over a decade now that medical care needs to be the core of services, but there needs to be a whole range of services to support that particular individual or that particular community.
I've used the dental.
My social worker. I'm in the behavioral health group.
Even housing.
It's almost like one-stop shop.
So these services are directly linked to saving lives, and it certainly saved mine.
I'm a big fan of how Ryan White plays into the HIV care continuum.
We have a very robust HIV counseling, testing, and referral program.
Once you get tested, and if they got people here to counsel you if you're positive and just talk you through things.
We have a linkage team which focuses on HIV prevention and linkage of new people who diagnose as HIV positive, as well as we have engagement and retention teams who then engage patients in their care.
Ryan White allowed us to treat people in their homes, go to them to give them care when they needed it.
Our ultimate goal is viral suppression and identifying those barriers that get in the way of that.
Our HIV viral load suppression is 85%, so I think that's in a large part because of the Ryan White model and our Ryan White funding.
If you examine any step of the continuum, you will see that the Ryan White funding really does support directly the social services that get our patients here and keep them here.
Case management allows us to work with our clients and to identify those things that may prevent somebody from getting into care initially and staying into care and getting as healthy as possible.
I have a great case manager, and he's been my case manager for about at least 15 years. And usually when I go through things, that's the first person I call.
I couldn't do my job without case management. Me writing a prescription, I can't put that plan into place the way that they do.
You know, I'm part of a group of 10 other men with HIV that I've been with 10 plus years. And it's kind of like a family. So there's no disease, there's no issue that any of us have to deal with that somebody else hasn't already been through. And it's great to have that. And Ryan White's made that possible by funding those programs.
Patients know that we care about them. They are individualized people. They are not just, you're another HIV person coming in. We go to great lengths to individualize every care plan, so every patient is able to access a variety of services that makes them feel at home.
This place is amazing. It's a place for people that just need a home for real, because it feels like home.